Disclaimer: this podcast is for informational and educational purposes only. It is not medical advice. I am not a doctor. Always consult with a qualified healthcare provider before starting any new supplement, peptide, or treatment. Argireline is a fascinating peptide often called the Botox peptide. It's known scientifically as acetylhexapeptide 8. This peptide was originally developed as a topical ingredient to mimic the effects of botulinum toxin without injections. Over the years, it has become one of the most popular cosmetic peptides in the skincare world. What makes Argireline so interesting is the way it works on facial muscles and fine lines. It doesn't paralyze muscles like Botox does, but it interferes with the signals that tell your muscles to contract. By relaxing the facial tension, the skin appears smoother, softer, and more youthful. Argireline is made up of 6 amino acids, which is why it's called a hexapeptide. It's derived from a protein found in Botox, but it's much milder and non-invasive. It works by inhibiting something called the SNARE complex. This is the mechanism involved in neurotransmitter release that causes muscles to contract. By blocking the signal at this level, it helps reduce repetitive movements like squinting or frowning, which are responsible for expression lines. Many people notice that when they use Argireline consistently, the fine lines around their forehead, eyes, and mouth become less noticeable. This isn't magic. It's biochemistry at work. The peptide helps minimize the micro movements that crease the skin over time. Unlike Botox, Argireline doesn't need a prescription, and it can be applied topically, which makes it a very accessible option for people who want a more natural approach to anti-aging. Another important thing to understand is that Argireline does not freeze the face. It won't give that stiff, expressionless look that Botox can sometimes create. Instead, it gently relaxes the muscles, allowing natural expressions to remain. That's why so many people like using it as an alternative or as a complement to injectable treatments. The science behind Argireline is well documented. Studies have shown that regular application of 5 to 10% Argireline solution can reduce the depth of wrinkles by up to 30% after just a few weeks. Most people start to see visible improvements in 2 to 4 weeks of consistent use. This makes it a favorite in many anti-aging skincare routines. Argireline is often found in serums, creams, and sometimes combined with other peptides like matrixyl or GHK copper. When used together, these ingredients can provide a synergistic effect, supporting collagen production, improving elasticity, and reducing visible lines. What's nice about Argireline is that it can be layered with other actives without causing irritation for most people. To get the most out of Argireline, consistency is key. It needs to be applied daily, usually morning and night. Because it works at the neuromuscular level, it doesn't provide instant results like a filler or an injection would. But with patience and routine, the skin gradually looks smoother and more refreshed. Most products with Argireline are applied to clean, dry skin before moisturizer. A few drops are enough for targeted areas like the forehead or around the eyes. It's recommended to pat it in gently rather than rubbing. Letting it absorb fully before applying other products helps it work more effectively. Argireline is considered safe for most skin types. It's non-invasive, non-toxic, and well-tolerated. There's no downtime and no risk of the kinds of complications that can come from injections. For people who are sensitive to more aggressive treatments, Argireline is a gentle yet effective alternative. One interesting aspect of Argireline is how it can be used preventatively. Because it reduces repetitive facial movements, it can help slow the formation of new lines. This makes it not only a treatment for existing fine lines, but also a proactive part of a skincare routine for people in their 20s or 30s who want to maintain smooth skin for longer. It's worth noting that Argireline works best on dynamic wrinkles. These are the lines caused by repeated facial expressions, like smile lines, forehead lines, and crow's feet. It won't have much effect on deep static wrinkles that are etched into the skin from years of sun exposure or loss of volume. But it can soften their appearance and make them less noticeable over time. Some people choose to pair Argireline with microneedling or dermarolling to enhance absorption. While this can increase its effectiveness, it's essential to follow proper hygiene and aftercare to avoid irritation or infection. For most users, simple topical application is more than enough. Argireline doesn't replace Botox or fillers, but it offers a great option for people who prefer a non-invasive approach or want to extend the time between injectable appointments. Some dermatologists even recommend using it after Botox to maintain results for longer. When it comes to formulation, concentration matters. Most products on the market contain between 5 and 10% Argireline. 5% is considered gentle but effective for daily use, while 10% can deliver stronger results. Starting lower and gradually increasing can help minimize the risk of any mild irritation, though that's rare with this peptide. Unlike some actives that can degrade quickly, Argireline is relatively stable in skincare formulations. It doesn't need to be refrigerated, though storing it in a cool, dry place away from direct sunlight can help maintain potency. If you make your own peptide serum, using a sterile diluent and clean tools is critical. Some researchers are exploring injectable forms of Argireline, but for now, its most common use remains topical. Because it's a peptide, it's gentle enough for daily use and works well in combination with other ingredients like hyaluronic acid, niacinamide, and antioxidants. This makes it easy to build into an existing skincare routine without disruption. One of the most common questions people have about Argireline is how fast it works. While individual experiences vary, most users start noticing subtle smoothing in about 2 weeks, with more noticeable results by the 4th week. Continuous use helps maintain those effects. If you stop using it, the benefits gradually fade as normal muscle activity resumes. There are no known serious side effects with Argireline. A small percentage of people may experience mild redness or tingling when first using it, but this usually resolves quickly. Patch testing before use is always a good idea if you have sensitive skin. Another benefit of Argireline is that it plays well with other skincare ingredients. It doesn't require special timing like some acids or retinoids, and it doesn't make your skin more sensitive to sunlight. It can be used both morning and night without any special precautions. Because Argireline targets the underlying muscle activity rather than the surface of the skin, it complements treatments that work on the dermis, like collagen-boosting peptides or exfoliating acids. A layered approach often yields the best results. Many people also enjoy the affordability of Argireline compared to Botox. It can be an excellent option for those who want to invest in their skin without spending hundreds or thousands of dollars on injectables. With regular use, it can give a noticeably smoother and more refreshed look. Argireline has become a favorite in the beauty industry not just because of its effectiveness, but because it gives people options. It empowers individuals to take control of their skincare without needing medical procedures. This aligns well with the growing movement toward gentle, science-based, preventative skincare. Some people ask whether Argireline can be used on areas other than the face. While most studies focus on facial applications, it may also be beneficial on the neck or décolletage. However, because those areas can be more delicate, it's wise to start slowly and monitor how the skin responds. The peptide's mechanism of action is quite elegant. By interfering with the SNARE complex, it essentially tells the facial muscles to relax just enough to stop creating those tiny creases over and over. Over time, this leads to a smoother surface. It's like telling your face to chill out a little bit without losing expression. Some experts recommend combining Argireline with collagen-stimulating ingredients for even better results. Because Argireline works on movement and other ingredients work on structure, they complement each other well. This approach targets multiple aspects of the aging process at once. A common misconception is that Argireline works immediately like a filler or Botox. It doesn't. It's gradual, gentle, and requires daily commitment. But for many people, that slow and steady approach is exactly what they want. It allows them to age gracefully while still looking vibrant. Because it's topical, Argireline can also be discontinued at any time without lingering effects. The skin simply returns to its normal state. This makes it low risk and easy to experiment with. Argireline is also fragrance-free in its raw form, which is ideal for people with sensitive skin or those who prefer minimal skincare ingredients. Most formulas are water-based and absorb quickly without leaving residue. For those interested in making their own Argireline serum, it typically comes as a lyophilized powder that can be reconstituted with sterile water or another appropriate diluent. Once mixed, it should be stored properly and used within the recommended time frame to maintain potency. It's also important to remember that while Argireline can do a lot for smoothing fine lines, healthy skin requires a holistic approach. Sun protection, hydration, good sleep, nutrition, and stress management all play a role in how your skin ages. Peptides can enhance your routine, but they can't replace overall lifestyle factors. When considering an Argireline product, look for formulations that list it near the top of the ingredient list. A higher concentration means better results. Pairing it with humectants like hyaluronic acid can help boost hydration and plumpness, enhancing the overall smoothing effect. Argireline is one of the best examples of how science can give us elegant, effective, and non-invasive solutions. It has stood the test of time in skincare, and it continues to be a favorite for people who want results without needles. Disclaimer: this podcast is for informational and educational purposes only. It is not medical advice. Always consult with a qualified healthcare provider before starting any new supplement, peptide, or treatment. Thanks for listening. Keep learning and stay curious.